I used to have infections every time I slept with my man every week. I would take antibiotics until they couldn't work anymore. A certain doctor advised me to dump the man I was dating, which I did and healed. So if you've had one man all through, and you experience these symptoms, of course you start saying, now this one must be a problem. So you have to question them. But if all of you are all over, it's difficult to know who actually brought this, okay? Yeah. But this is not a sexually transmitted infection, even though there's a link between the sex and this one. Because remember, for Candida albicans, most women get it not from anywhere else. They get it from the men, because men act as carriers. When a man gets the Candida, the yeast infection, they just get some small itch and it's gone. They never feel it, but they act as carriers, and now they reintroduce it to their women. You see a woman goes and takes the vaginal pills, the douches, and also the pessaries. They use them, the antifungal pessaries. They take antibiotic therapy. It disappears, and then it comes back. You should start doubting the guy. You should actually take him for antifungal therapy. But these infections, most of them happen in pregnant women and immunocompromised. Pregnant women experience a lot of yeast infections because their immunity is going down, because literally they are sharing the immunity with the child. And of course, they are eating very unhealthy foods, which actually brings them to the question of low immunity. Okay, and then that brings in so much problems concerning this. And also, women are so prone, because I've already told you. You see, the anatomy of the vagina or the reproductive system of a woman actually exposes them to these conditions. And then, of course, hygiene is very important. I've seen most women who come from the 𝗥𝗘𝗖𝗏 region. They are those women who use water to wash their organs, those women who overdress. This is a problem, because you use water, you create a filthy environment for yeast survival, and then you end up overdressing. You put on a panty, you put on a biker, you put on a tight, and then now a kamisi, and then now a buibui or such kind. We are not against that, but we're telling you, if you're going to use water to clean up your genitals, make sure you dry it adequately. Because if you don't do that, you're going to create a filthy environment. And that's why urinary tract infections are so prone in the northern region. You have this water that you used, and then now there is a lot of heat because of the sun. So there's a creation of a very filthy environment around your genitals. Now you start itching because the yeast loves a filthy environment. And of course, they are the number one leaders of consuming the wheat, the seed oils, and the sugars. Okay? So you will never lack these infections in them. You will never lack it. And apparently, they will come and tell you, I have a kidney problem. So they call urinary tract infection, ugonjwa ya kidney. Nipe ile dawa ya kidney. I'm like, and he gave me ile dawa ya kidney. I'm like, okay, so you know it anyway. But by the time it's getting to the kidneys, you will not have a say in terms of nipe ile dawa ya kidney. Okay, so women are prone because of their anatomy. Okay, and then they have a short urethra. You see, for men, we have a long urethra. Urethra is the tube that carries urine from the bladder outside. Okay, so it's a longer one in men. So by the time these microorganisms get access to the top level, they're already washed out. So they rather, it's uncomplicated in men because they will stick at the lower levels instead of going higher into the kidneys and the blood and above. Okay, but for women, they have a shorter urethra, so they introduce these bacteria into their vagina, and then they climb so fast into the urinary tract system. And you see, ladies are the ones who drink water without adding salt. They want to rehydrate, they want to have a good skin, but they just drink water aimlessly without adding salt. So they keep on just flushing and changing the environment of the vagina, causing it to be less acidic, and now these bacteria get a chance to survive. So it becomes serious in ladies. But a good cause is actually low immunity, and low immunity is actually being brought about by a lot of things. One is sugar, and you know very well how sugar holds on to the white blood cells. So by the time they're getting to where there is an infection, it has taken time, and these infections has already grown. It's actually, the microorganisms are actually multiplying. Cystitis is part of UTI, doc. Cystitis, yes, is part of UTI. How? When you have this bacteria or this fungi going up into the bladder, and then they start irritating the bladder, that is actually what we call a cystitis. So inflammation of the bladder. Can UTIs cause infertility? Yes, recurrent UTIs can actually expose you to infertility, because once they start affecting the reproductive health system, because some of them can get access to the reproductive health system, and they cause you a lot of problems. But I want you to see this. Sometimes we blame these bacteria for no good reason, because I've seen people talking about how these can actually cause infertility. But on a larger scale, if you open up your mind so big, you'll see the reason why women got urinary tract infections is because of hormonal contraceptives. That is one of the cause of urinary tract infections. Hormonal contraceptives increases estrogen levels. Some of the hormonal contraceptives which have estrogen. So we increase estrogen levels. Now estrogen is the one that actually can cause irritation and dryness of the vagina. So you reduce the mucous membrane and the covering of the vaginal wall or the reproductive health wall, reproductive system wall. Once you do that, you have exposed it to infections. You've exposed it to this bacteria to actually attack the wall directly. Okay, and it can go up into the ovaries and bring you a lot of problems. So, number two, hormonal contraceptives lower immunity, exposing you to more infections. But the infertility that most women get is actually linked to the contraceptive use more than it's linked to the urinary tract infections, because on a rare occurrence will you get infertility from these UTIs. You'll get it more from the use of contraceptives. And you see, we blame the microorganisms which are thus there trying to enjoy their life and live healthy. But we blame them, yet we are the ones who are actually affecting our immune system. We are the ones who don't carry out hygiene properly. We are the ones who use contraceptives. And then we end up blaming the microorganisms. We treat them, they don't go anywhere, they come back because our immune system is still down. And I've told you multiple times, if you're treating an infection, you're not treating the infection to kill it. You're actually lowering the burden of the bacteria or the virus or the fungi or the protozoa so that your immune system takes over. So imagine you taking antibiotics and taking antifungals every single time, but you're there with a hormonal contraceptive. You are there with an implant or an injection or the coil that is hormonal, or you're on estrogen replacement therapy, the hormonal replacement therapy in women who are getting to old age. You have estrogen dominance through diets and contraceptive use, the non-sticky pants, the skin products that we use that have phthalates. All of them are raising estrogen and they're exposing you to low immunity. So ladies, this is a topic that you should take with a lot of keen. So you cannot blame microorganisms, yet the problem is what you heard. How about tampons? We said tampons, WNN. We said tampons should be let go. Please, we want to finish the population of our politicians. Let them use the tampons because they're the ones who actually import them. Let your politicians who brag about tampons, let them use them. They suffer on our behalf. See, they are our representatives. Yeah? See, that senator who is talking about tampons and how she uses tampons, she is our representative, right? So we want her to use all our tampons so that she carries our burden of these tampons. So ladies, tampons that are made up of they are made up of arsenic, they are made up of heavy metals, and these heavy metals are going to expose you to cancer. I shared a study on my Telegram platform that was talking about the raw materials that make the tampons. So let that remain, the tampons, let it remain for those politicians, our representatives. Let them act as samples. They sample it, you will use it when they have sampled it and it's okay. But now, let it be. Do not be fancy about it. Just use a normal pad. You need it. Just use a normal pad. Don't be fancy about anything. So limit the exposure to heavy metals, specifically arsenic. And also there's this shock that actually hits women who use tampons all the time. You get this shock from the infection of the bacteria and it's crazy. So you don't have to use those things. Just use a normal pad. Anyway, number one, we say it is incomplete bladder emptying. Sometimes, okay, actually, when you have incomplete bladder emptying, this is one of the causes of UTI. You retain urine there, you retain microorganisms there, and you end up suffering from a UTI. So when you go to the toilet, take your time. There are these people who run to the toilet, before they finish their business, they're out. Go to the toilet and take your time and let the urine go out completely, unless you have a problem with the bladder. And that is diabetes, so you have to actually fix diabetes. So go to the toilet, respect the toilet, finish your business, empty the bladder completely and come out. And if you empty the bladder completely and you still feel the urge to urinate, simply know that you already have a urinary tract infection. Go for a checkup. Go for a checkup. Doc, what of the menstruation cup? I have never been against the menstruation cup, but you see, the material that makes it, just go and check the material that makes it. Go and check the material that makes it. Is it plastic? Is it the polyvinyl chloride? Is it that? If you see the material, start running away from it. That's why I'm telling you, make your life easier. Do not be fancy about these things. It's not a fancy procedure. And I've seen how ladies just insert that cup inside there. And I'm like, oh, too much work anyway. But look at the material that is made to make that cup. So let's continue. So hormonal contraceptives. We have incomplete bladder emptying, because when you retain it, you retain the bacteria. And then we have sexual activity, of course, that's another cause, that's another exposure. And then we have what else? We have compromised immunity, basically diabetes, cancer, medicines like steroids and anti-cancer medication. Also antibiotic use. Those people who keep on using antibiotics every time. You take an antibiotic this week, tomorrow, next week you're using an antibiotic. The other week you're using antibiotic. You have a common cold, you're running to take azithromycin or amoxicillin. That is going to bring you a lot of problems, because antibiotics that you're using, most of them are actually broad spectrum. They target all types of bacteria, both the good and the bad bacteria. Once that happens, you end up clearing all the good and bad bacteria. And remember, the good bacteria in the vagina are there, like lactobacillus, is there to actually keep the bad bacteria in check. Okay, so it's actually your immune system, part of your immune system. So it keeps them in check. So if you use antibiotics all the time, for no good reason, even for viral conditions, you're using antibiotics, you're going to flush out all these microorganisms in the vaginal tract, and you will expose yourself to low immunity and then infections. So be careful when you're using that. Be careful on hormonal contraceptives, be careful with diabetes, be careful with cancer and cancer medications, be careful with antibiotic use, be careful with steroids. And you've seen nowadays, ladies are using steroids to actually broaden their hips and make their faces round. They have this moon face, and you can see their skin is like glass. You've seen that? Oh, I have a glassy skin. Seen your influencers saying that? Yes, that is basically the use of steroids. And that is not a glassy skin. That is a side effect, or that is a symptom of a kidney failure. So that glassy skin that you want is a symptom of a kidney failure. It is water accumulating under the skin. That's a moon face. Now, those steroids are going to weaken your bones. They're going to lower your immune system. They're going to destroy your heart. They're going to destroy your skin. And now they're going to cause something called lipodystrophy. So they will cause an even distribution of fat everywhere. So imagine getting fat from the buttocks, taking it to the shoulders. Now you look like a buffalo. It's called buffalo hump, actually. so now you have this thin waist, and you're looking like somebody slapped you from behind. And then you have this buffalo hump. Ladies, sometimes you do so many things for your ego, and it's not just going to help you. That ego that you use, please stay away from that ego. Stay away from ego. And these are things that you can actually prevent. If it's diabetes, simply eat healthy and start fasting. If it's cancer, eat healthy, start fasting. If it's medicines, use antibiotics only when necessary. And every after an antibiotic therapy, make sure you consume fermented cabbage, the sauerkraut, or the kefir, or any fermented food to replenish the gut microorganisms. Don't go for yogurt. Don't go for yogurt unless you're making yogurt at home, straight from the milk that is not boiled. But if you're going for yogurt in the supermarket that is written on probiotic, they are targeting you. They know you're the product, because if it's marketed, you are the product. If you're using these vaginal douches, perfumes, pineapples, you want to use a pineapple to make your vagina smell well for your boyfriend during the weekend, just know you've been eating very unhealthy foods. And by the time you're having that insecurity that, oh, you know what, maybe I need a pineapple to actually fix this problem, you have a problem. Go fix the problem. Stop using pineapples, which are just sugars. So as you urinate that pineapple through urine, is for a short term. But then the long term is, you're introducing sugar in your reproductive health system, and now you're going to get into problems. Okay? Good. Good. So yes, another one, also catheters. And again, catheters, problems with the bladder. So where are the problems coming in? The diets. Imagine how that, when we say fix the kitchen, there is a whole load of information about fixing the kitchen. And the problem is, some of you, when I tell you to fix the kitchen, you simply go and fix the kitchen for 2 days, and you're back and telling me, oh, I still have recurrent yeast infection. I'm like, but you just fixed the kitchen. Have you fixed the gut? Follow up. You can fix the kitchen and then leave it there. Fix the kitchen and now fix the gut. Okay? Because you have to eat these foods. You don't just fix the kitchen and then sit there waiting for your condition to disappear. You must put in the work. Okay? Put in the work. Because fixing health is not a one-day occasion. It's a long period of time occasion. And a lady who doesn't wait at all, shida ni, one, you're in a hurry to have sex. Okay, you're in a hurry to have sex. Number two, possibly you're on hormonal contraceptives that are raising estrogen levels. Number 3, your diet is messed up because estrogen is going up, is being fed through the diets. You're using non-sticky pans, you're using skin products to lighten your skin or to actually protect your skin. Okay, you never fast, you still eat sugars, seed oils, and wheat products. So then fix that. Fix that. And then sex starts from here, starts from the head. It doesn't start from the organ. So you must find a man who makes love to your brain before making love to the organ. Somebody is saying she doesn't love you. Ladies are incapable of loving a man, okay? They respect and submit to a man. And a lady who likes or admires a man will easily wait. You don't even need to touch her. I get UTI every before my periods. Yes, that is true. Most ladies get urinary tract infection before their periods because this is the time the estrogen level is going up. Okay, so periods are controlled by estrogen. Estrogen goes up, lowers the immune system. When it lowers the immune system, boom, you get a problem. You get that problem. So you can actually fix estrogens by eating healthy and fasting. Lower the estrogen levels, maintain now your health. So probiotic yogurt is not good. It's not even probiotic yogurt. It's just the name. The rest is just a product, just the way we called it. Probiotic yogurt, now I add their product. Anything that is coming from the industry is not there to help you. It's there to actually make profits for the food industry. So use fermented cabbage that you can make by yourself. Use kefir. Use kombucha. Make it at home. Do not trust anything that is coming from the industries. You look at it this way. How is it that yogurt has lactobacillus, which is a microorganism, but it still has a preservative? So which microorganism survives in something that has a preservative? What is a preservative in the first place? And then it is pasteurized. Pasteurization means passing it through heat to render it sterile so that it doesn't go bad. So you tell me, why would we pasteurize milk and then add a preservative and then add a microorganism? How will that microorganism survive when there is a preservative? Do you see the bigger picture? Is kombucha good for people with DM? Yes, it is, because it is fermented. When you ferment something, the microorganisms consume the sugar. Women who are over 50 do not wet. Is it true they don't? Because they have high estrogen levels. They lower estrogen, they get wet. So let them stop eating sugars. Let them fast. Let them eat healthy. Okay, let them eat fatty meats, because fatty meats are the ones that actually produce these hormones, and let them ease up on stress levels. So they're actually normalizing menopause. You don't have to normalize menopause. Menopause is a period where a woman has done what they have to do. They have given birth. Now it's time for them to rest. They need to imagine you've worked hard during the day, and then when you're returning to bed, there is no sleep. You'll be so irritated. So that's the same way to the same thing or the same application to menopause. So menopause is supposed to be smooth because the woman has done her job. Now it's time for her to rest. So it's not supposed to be problematic. Okay. What kind of pan to use instead of non-sticky pans? Just use stainless steel. Okay, good. Yes, so urinary catheters, compromised immunity, hormonal changes like pregnancy, like hormonal contraceptives, like menstrual cycles, incomplete bladder emptying, and of course, kidney stones. By the way, there is one microorganism that is totally associated with kidney stones. You remember the microorganism that we were talking about when we started this? We talked about Escherichia coli, we talked about Klebsiella, we talked about Proteus mirabilis. Proteus mirabilis, it is known for complicated urinary tract infections and it's associated with kidney stones. Proteus mirabilis. How about granite? Use granite, it's good. Proteus mirabilis, mira. Okay, Proteus mirabilis. It is associated with complicated urinary tract infections, that is one, and then kidney stones. So you have to avoid that one by all means by boosting your immune system. Because it's resistant to antibiotics, because it's now causing complicated, because it goes higher towards the kidneys, and then it is a dangerous one because it is going to cause you kidney stones. So it's associated with kidney stones. Good. And then also kidney stones are actually a cause of urinary tract infections because they hold back the urine, you retain the bacteria, infections. Poor hygiene. We've talked about women wiping from back to front. That is a problem. Wipe from front to back. Number two, we've talked about women who use water in the toilet to clean their genitals. They must dry it adequately. Right? and then you don't overdress. How would you put on a panty and then put on a biker and then put on a tight and then put on a kamisi and then put on? Why are you overdressing? I mean, what is there to hide that much? Let the organs breathe. And then women who air their panties in the bathroom. So you air your panties under in the bathroom and also under your towel. That doesn't make sense to me. Air your undies in the sun. Let the sun sterilize, because sun, UV radiation is actually a sterilizing agent. So air your pants outside. And nowadays, most of you are living in houses that don't even have lights. Your houses are so chromed. You've seen nowadays, a house is actually being joined with another house. Nyumba zimeshikana everywhere. And once that is happening, there's no enough light in your space. That's a very good environment for molds and yeast infections. And then now you air your undies in the bathroom, which does not get light, and then you put a towel on top of it. And then our panty stays there for a week without drying. Air them outside. We don't wear them anymore, docs. Ah, okay, my host. I know, nowadays it's just commando. Commando. Ladies, hey, yes, squeezy. You are ready for anything, anywhere, anytime. Huh? Just a trigger. You're ready for anything, anywhere, anytime. Ah, well. No wonder we see these videos that are trending everywhere. People having sex everywhere. So not only did you expose yourself to microorganisms, you're also now having exposure through the sexual experiences that you're having, the quickies that you're having everywhere. Good. And then antibiotics use, and then sugar, of course, in form of diabetes. Sugar is a crime in terms of reproductive health and in terms of urinary tract health. So sugar becomes a problem. What is kombucha? Kombucha is fermented tea. And the most recent one now, the most recent cause is ladies who do douching, vaginal douching, and applying perfumes so that their cookies smell well. Listen, ladies, listen. A vagina, just the same way an ear cleans itself. You see, our ears are self-cleansing. Do not even use the ear swabs. The vagina cleans itself. It's a self-cleansing organ. So do not use the vaginal soaps. Do not use antibacterial the antibacterial soaps. Do not use perfumes. Do not eat pineapples. Do not use yogurt. Avoid those things with all you have. Avoid them. Let that organ clean itself. What you need to do is you need to eat healthy. Once you eat healthy, the organ cleans itself. But now your problem is you want to eat unhealthy foods and then go use a vaginal wash. They are very famous nowadays and they are very expensive and you people afford them. So stay away from that nonsense. Fix what you have to fix. Fix your health through the kitchen. Start fasting, eat healthy, and the rest will align. And if you get an infection, possibly go to hospital, get an appropriate treatment. Do not go to the chemists to do a urinalysis test in the chemist. Go to the hospital. Get tested and then treat for infections. If it's a fungal infection, use antifungals and then fix the diet. If it's a bacterial infection, treat bacterial infection. Do not be somebody who self-medicates. You run to the pharmacy because you have an itch. You're busy asking doctors on text, doc, you know, I have this itch. Doc, blah, blah, blah. And then you end up in a pharmacy with a prescription. You buy antibiotics that are broad spectrum. You buy antifungals. Once you do that, you destroy the environment of that tract and you end up exposing yourself to issues.